What is bipolar disorder? Bipolar disorder, also known as manic depression, is a mental illness that brings severe high and low moods and changes in sleep, energy, thinking, and behavior. People who have bipolar disorder can have periods in which they feel overly happy and energized, and other periods of feeling very sad, hopeless, and sluggish. In between those periods, they usually feel normal. You can think of the highs and the lows as two poles of mood, which is why it's called bipolar disorder. The word manic describes the times when someone with bipolar disorder feels overly excited and confident. These feelings can also involve irritability and impulsive or reckless decision-making. About half of people during mania can also have delusions, believing things that aren't true and that they can't be talked out of, or hallucinations, seeing or hearing things that aren't there. Hypomania describes milder symptoms of mania, in which someone does not have delusions or hallucinations, and their high symptoms do not interfere with their everyday life. The word depressive describes the times when the person feels very sad or depressed. Those symptoms are the same as those described in major depressive disorder or clinical depression, a condition in which someone never has manic or hypomanic episodes. Most people with bipolar disorder spend more time with depressive symptoms than manic or hypomanic symptoms. Bipolar disorder types. There are a few types of bipolar disorder, including Bipolar I disorder. With this type, you have extreme erratic behavior, with manic up periods that last at least a week, or are so severe that you need medical care. There are also usually extreme down periods that last at least 2 weeks. Bipolar II disorder. With this type, you also have erratic highs and lows, but it isn't as extreme as bipolar I. Cyclothymic disorder. This type involves periods of manic and depressive behavior that last at least 2 years in adults, or 1 year in children and teens. The symptoms aren't as intense as bipolar disorder I or bipolar disorder II. With any type of bipolar disorder, misuse of drugs and alcohol use can lead to more episodes. Having bipolar disorder and alcohol use disorder, known as dual diagnosis, requires help from a specialist who can address both issues. Bipolar disorder symptoms. In bipolar disorder, the dramatic episodes of high and low moods do not follow a set pattern. Someone may feel the same mood state, depressed or manic, several times before switching to the opposite mood. These episodes can happen over a period of weeks, months, and sometimes even years. How severe it gets differs from person to person, and can also change over time, becoming more or less severe. Symptoms of mania, the highs. Excessive happiness, hopefulness, and excitement. Sudden changes from being joyful to being irritable, angry, and hostile. Restlessness. Rapid speech and poor concentration. Increased energy and less need for sleep. Unusually high sex drive. Making grand and unrealistic plans. Showing poor judgment. Drug and alcohol abuse. Becoming more impulsive. Less need for sleep. Less of an appetite. Larger sense of self-confidence and well-being. Being easily distracted. During depressive periods, the lows a person with bipolar disorder may have. Sadness. Loss of energy. Feelings of hopelessness or worthlessness. Not enjoying things they once liked. Trouble concentrating. Forgetfulness. Talking slowly. Less of a sex drive. Inability to feel pleasure. Uncontrollable crying. Trouble making decisions. Irritability. Needing more sleep. Insomnia. Appetite changes that make you lose or gain weight. Thoughts of death or suicide. Attempting suicide. Bipolar disorder causes. There is no single cause of bipolar disorder. Researchers are studying how a few factors may lead to it in some people. For example, sometimes it can simply be a matter of genetics, meaning you have it because it runs in your family. The way your brain develops may also play a role, but scientists aren't exactly sure how or why. Bipolar disorder risk factors. When someone develops bipolar disorder, it usually starts when they're in late adolescence or young adulthood. Rarely, it can happen earlier in childhood. Bipolar disorder can run in families. Men and women are equally likely to get it. Women are somewhat more likely than men to go through rapid cycling, which is having 4 or more distinct mood episodes within a year. Women also tend to spend more time depressed than men with bipolar disorder. Bipolar disorder usually develops later in life for women, and they're more likely to have bipolar disorder too and be affected by seasonal mood changes. A combination of medical and mental issues is also more common in women. Those medical issues can include thyroid disease, migraine, and anxiety disorders. Some things that make you more likely to have bipolar disorder include having a family member with bipolar disorder, going through a time of high stress or trauma, drug or alcohol abuse, certain health conditions. Many people with the condition abuse alcohol or other drugs when manic or depressed. People with bipolar disorder are more likely to have seasonal depression, coexisting anxiety disorders, post-traumatic stress disorder, and obsessive-compulsive disorder. Bipolar disorder treatments. Bipolar disorder can be treated. It's a long-term condition that needs ongoing care. People who have 4 or more mood episodes in a year, or who also have drug or alcohol problems, can have forms of the illness that are much harder to treat. Medication. Medication is the main treatment, usually involving the following. Mood stabilizers, such as carbamazepine, Tegretol, lamotrigine, Lamictal, lithium, or valproate, Depakote. Antipsychotic drugs, such as cariprazine, Vraylar, lurasidone, Latuda, olanzapine, Zyprexa, and quetiapine, Seroquel. Antidepressants. Antidepressant antipsychotic drugs, a combination of an antidepressant and a mood stabilizer. Anti-anxiety medications or sleep medicines, such as sedatives like benzodiazepines. It can take a while to find the right combination for you. You may need to try a few things before you and your doctor figure out what works best. Once you do, it's important to stay on your medication and talk with your doctor before stopping or changing anything. Women who are pregnant or breastfeeding should talk with their doctors about medications that are safe to take. Psychotherapy. Psychotherapy, or talk therapy, is often recommended too. There are several different types. Options can include interpersonal and social rhythm therapy, ISPRT. This is based on the idea that having a daily routine for everything, from sleeping to eating, can help keep your mood stable. Cognitive behavioral therapy, CBT. This helps you replace bad habits and actions with more positive alternatives. It also can help you learn to manage stress and other negative triggers. Psychoeducation. Learning more and teaching family members about bipolar disorder can help give you support when episodes happen. Family-focused therapy. This sets up a support system to help with treatment and helps your loved ones recognize the beginning of an episode. Other treatment options for bipolar disorder can include electroconvulsive therapy, ECT. Small doses of electricity shock the brain and set off a small seizure to kind of reboot it and change the balance of certain chemicals. While it's still a last resort treatment when medications and therapy haven't worked, it is much better controlled and safer, with fewer risks and side effects than in the early days of this procedure. Acupuncture. There's some evidence that this complementary therapy may help with the depression caused by bipolar disorder. Supplements. While some people take certain vitamin supplements to help with the symptoms of bipolar disorder, there are many possible issues with using them. For example, their ingredients aren't regulated, they can have side effects, and some can affect how prescribed medications work. Be sure to tell your doctor about any supplements you take. Lifestyle changes may also help. Get regular exercise. Stay on a schedule for eating and sleeping. Learn to recognize your mood swings. Get support from friends or groups. Keep a symptom journal or chart. Learn to manage stress. Find healthy hobbies or sports. Don't drink alcohol or use recreational drugs. Thank you for watching and listening to our video. If you like this video, please subscribe and share with others. Comment below for any suggestions.